Good afternoon. I just wanted to share with you some thoughts as now that I've come back as interim dean at the College of Nursing. I've been away from the College of Nursing for 10 years, but back into the thick of things and really wanting to just talk a little bit today about some of my thoughts around the current status of nursing in the province of Saskatchewan, the roles of both the union, the Saskatchewan Union of Nurses, and our professional organization, the Saskatchewan Registered Nurses Association, SRNA. My background is long and checkered background. I worked in the Detroit Medical Center, actually in a non-union environment for 8 years. When I made the jump back to working in Windsor, Ontario, I was quite involved in the Registered Nurses Association of Ontario. Used to be the chapter president of the Windsor Essex County chapter. I was also involved as a nursing student, actually, when the Ontario Nurses Union was just forming. And I wore my little badge on my uniform in support of the new Ontario Nurses Union. Back in those days, nurses had really very low salaries, and they had very modest, if anything, pensions. In fact, for the 8 years I worked in the Detroit Medical Center, I found out subsequently that all those years I'd worked had never been vested, because back in those days one had to work for 10 years in order to have any of your pension vested. So I'm no stranger to why we have professional unions, and they're very important. So too are our professional organizations. They have different role, different mandate, and together they're to work in balance. I have been following over the past couple of years, even though I haven't been involved in nursing education per se, and I was involved more in research and negotiating the new Saskatchewan Centre for Patient-Oriented Research. I was aware of the work that had been going on around concerns of LPNs and their scope of practice. I did want to share with you my own view, and this is a generalization, and I'd be the first one to own that. But in general, I see so many unmet needs in terms of health of our patients, our families, our communities, the residents that we serve. There are huge amounts of unmet needs out there. We try and cover the priority ones, but there are many unmet needs. My biggest concern actually has been that I think in terms of comparing Saskatchewan to many of our other provinces, that in many instances our registered nurses are not working to their full scopes of practice. And certainly I see a lot of places in our health system where nurse practitioners could help a great deal, and I'm very familiar with the literature on nurse practitioners. They've been demonstrated to be revenue neutral. They don't save you money, but the patient outcomes are much better. They're more likely to utilize best practice guidelines. They're very good value for money and have found really important roles across the country in long-term care settings, in emergency departments, mental health, renal, you name it. They've been a really important addition to the healthcare system. So here in Saskatchewan, I think we have real opportunity to actually work together across our various nurses unions and various professional organizations to think about how we really maximize all nurses' scopes of practice. I think at the end of the day, that conversation may be more salutary, in other words, more life-generating, more positive, than hashing it out with one another and trying to curtail one another's scopes of practice. If I thought there wasn't enough healthcare needs to go around, but I assure you, I don't see that as being the case. And I think we always do our best when we work together and we collaborate. It probably sounds like a motherhood statement, but I've always found that. whether I'm talking about how my family operates and pulls together and support one another, or whether I'm talking about a profession, or I'm talking about an individual organization, or we're talking about a province. So I think we have a lot of work to do in terms of ensuring that everybody is working to their full scopes of practice. That really brings out the best in individuals. It's what they came into the profession for, or their various professions for. It helps people be passionate about their work they do every day. Nobody wants to feel, whether they're a personal care aide or they're a surgeon, wants to feel that their practice is being circumscribed or they're not able to do everything that they were trained to do. So I know that a motion was brought forward at the annual general meeting today around developing a task force to move forward to look at RN and NP, scopes of practice in particular. And I certainly applaud that. I hope that we will move forward, and speaking on behalf of my colleagues in the College of Nursing, and certainly many of our students that I've been able to speak with, there's a lot of enthusiasm for embarking on that venture, both for today and also thinking about what those roles and responsibilities should be over the next 10 years or so. Given the dynamic environment that we live in, 10 years is probably about perhaps as far as we want to go in terms of speculating on what those roles and responsibilities should be. Anyway, I welcome your thoughts. I appreciate the opportunity to speak with you today, and look forward to ongoing dialogue about our best utilization of nurses, both in Saskatchewan, in Canada, and around the world. We entrust our own lives and the lives of our families to these individuals on a regular basis. It behooves us to think long and carefully about how we best utilize the precious resource that is nursing.